Hi, you're back today to discuss your sleep study. Let me tell you a bit about the different options and the outcomes. Sleep apnea, as you know, can be obstructive or could be central. And today I'm going to talk mostly about obstructive sleep apnea. In your recent test, your sleep apnea will be defined as either mild, moderate, or severe. If it is mild, that means the number of events that your brain was woken up because of a breathing disorder is about 5 to 15. Moderate would be 15 to 30, and more than 30 would be severe. Severe is more a representation, therefore, of the number of events, but also is important because treatment generally does improve risk of future problems. If it's moderate, in the same way, but mild's a little different. Mild generally is treated for symptoms rather than the risk of future problems. If you remember, the future problems in sleep apnea that I'm talking about include risk of heart disease, strokes, irregular heartbeats, erectile dysfunction, maybe feelings of depression, impaired glucose tolerance or worsening of diabetes, and of course, as you remember, there are many other potential risks. In mild sleep apnea, there are two options. Depending on whether sleep apnea is mild, moderate, or severe, we can determine what the best options together would be to treat you. We can treat you with CPAP, which is continuous positive airway pressure, but also includes things like self-regulating CPAP, bi-level pressure or BiPAP, etc. We can use an oral appliance. There are some surgical techniques which I could talk to if necessary, but generally I think using the non-invasive techniques is better in the beginning. And then there are some salvage techniques which we will talk about as well. So the two major options that we're talking about include the use of an oral appliance or oral appliance therapy or a mandibular advanced device. And there is the option of CPAP or continuous positive airway pressure. An oral appliance, which looks somewhat like this, is a device that is made by a specialist that pushes the lower jaw forward in order to open the back of the airway. And that is more successful if you have mild sleep apnea and more successful if you are thinner. The other options include CPAP, and CPAP rarely works for mild, moderate, and severe. The use of an oral appliance is also potentially possible in moderate, but as I mentioned, as the sleep apnea gets more severe, the indication for an oral appliance gets less because the effectiveness is perhaps a bit less. The oral appliance also is expensive and is custom made. Now the CPAP device, which is a device that fits over your nose, and there are lots of different masks, goes via a tube to a machine. And the machine could look somewhat like these. There are travel machines as well if they become necessary. These machines apply air pressure to keep the airway open and therefore stop the throat from collapsing. So when I see you, I'm going to discuss your understanding of these devices and your sleep study result, and we'll choose an option that's best suited to you, and most importantly, we'll work together to make sure that it works well for you so that your sleep is more peaceful, more calm, and we reverse the sleep apnea.